morning. All right, we have an awesome session for you all today, so I'm going to get started here in just a minute, give a quick little kickoff, and then I can pass it off to this amazing panel. But just wanted to say welcome and thank you guys for being here, especially early in the morning. My name is Candace Digby. I am co-founder of Austin Design Week. And you can connect with us all across the week on social media. So tag us, please, and post your screenshots and your takeaways and your learnings. It's a great way to connect with us. But also, if you haven't already, we really encourage you to join the ADW Slack workspace. So our volunteer here in a second will be dropping all this information in the chat with great links, so you can just go directly there. But that's a great way to continue the conversation, but also let us know if you need any help with anything technical. There is a help desk channel for just such an occasion. We also want to say a huge thanks to our generous sponsors for making this year happen. We can literally only do this with our sponsors because this is completely volunteer run and all free for you all. So big, huge thank you to them that make this possible for us. And then finally, at the end of the event, there will be a survey that will be dropped in the chat. It's a great way for us to be able to deliver feedback back to this amazing panel who's put this together and worked on this, but also ways for us to improve in the future and let us know what you liked. And kind of help us gauge, the response. It's a really helpful thing. So it's really quick, I promise. And we really encourage you to do that at the end of the session. Okay, it's the time. Now I'd like to pass it over to our amazing panel of folks, and let's get this started. Thank you, guys.
Awesome. Thanks so much, Candace. We've got quite a crowd. I see 63 participants in the audience. Thanks for joining us, especially on an early morning. We're always gratified to have so many people join us during Austin Design Week. My name is Stacy Chang. I'm the Executive Director for the Design Institute for Health. We are a joint collaboration between the School of Design and Creative Technologies at UT and the Dell Medical School at UT. And we spend most of our time applying the craft and capabilities of one school to the challenges that the other school faces in modern society. We are always grateful, I think, for having so many people join us. We've been a member of Austin Design Week since the very beginning. Personally, I've even had the opportunity to serve on the advisory board. And it is gratifying to see people care so much, one, about design in this community, but also in its application to health and healthcare. The topic today really is about people helping people. And we'll talk a little bit about a number of case studies and see if we can draw some conclusions. We'll definitely leave some room for a Q&A as well. So on to the logistics for this webinar. We are on a Zoom webinar, which is a version of Zoom, which means the panelists and moderators can see each other, but we're the only ones on screen. So we'd love to see all of your Hollywood square faces. Unfortunately, 72 of you would turn you all into tiny little thumbnails, which we would definitely not be able to see. You also can't share your audio or video. Your mic is automatically muted, but you are not silenced. You have both the Q&A and chat functions to chat with us. Feel free to chat throughout the conversation and add questions into the Q&A. We are going to save some time at the end of the panel discussion for explicit Q&A. If there are a lot, we will try to get through as many as possible, but definitely upvote them if there are ones that you see that you want answered as well. So I think that's the logistics. I'm gonna ask each of the panelists to introduce themselves, but before I do, here's the agenda. We're gonna do a quick introduction of team members. We've got a little bit of an interactive polling activity to sort of get us all warmed up and engaged. And then we're gonna talk through a couple case studies. There are some overarching themes that we see in the work that we do, which we wanna share, and there are aspects of each of those in the case studies that we're gonna share with you. And then we'll save some time for Q&A before we adjourn. So cool. I'm going to ask each of the panelists to introduce themselves, maybe in the order that we're seeing here, and then after that, we'll move on to the polling activity. Rose, you're up.
Hi, everyone. Thank you so much for being here. My name is Rose Lewis. I am the social service designer at the Design Institute. I have a little bit of a hybrid role between service designer and design researcher. And I have a master's in social work, so I bring that perspective to the work at the Design Institute, especially in our community work. Again, thank you for being here.
Thanks, Rose. Natalie?
Hi, I'm Natalie Campbell. I'm the visual designer at the Design Institute. I also have played somewhat of a hybrid role on two of these projects as part service designer and design researcher. And with my work at the Institute, I'm really thinking about how we can effectively communicate to our users across services and systems that we design within.
Awesome, thanks. Artin, you're up. You probably want to unmute though.
Yes, of course. Hello, everyone. My name is Artin Hartunian. I'm the systems designer at the Design Institute. I also play a hybrid role, doing different kinds of design, but as a system designer, I look to understand how systems work from everyone's perspectives and communicate that to everyone involved in the system. So nice to meet you all.
Thanks, Artin. Hey, Ryan.
Hi, I'm Ryan Grindstaff. I am completely separate from the Design Institute. They brought me in April to help work on one of the projects. I've been a social worker since 2014, working with children and families, and have built a really strong relationship with the Design Institute through this project.
We're super happy to have Ryan with us. She's got some cool stories to tell. Well, cool. So I'm going to hand it off to Rose and Natalie, who are going to take us through the interactive polling activity.
So if everyone could open either on your laptop or phone, we're going to go to Slido, and you just have to enter the event code there on the screen, K055. And we're going to go through this polling exercise. And one thing that you'll notice with the questions is that each answer that you choose for each question has a certain amount of points. So make sure that as you answer the questions, you record the amount of points that you're selecting, and then we're going to add up the points at the end. So just make sure to keep track of that.
All right, so we'll give you a few seconds to get in there, and then Adam's going to start our questions.
All right, so the first question on the screen is regarding transportation. Again, if there's a few different answers on there, and make sure to record the amount of points for each question as we go through it. And I'll give y'all about a minute or so to select your answer, and I'll let you know when there's a few seconds left.
We're up to about 62 responses.
There's about 20 seconds left for y'all to choose an answer. Okay. I think we're going to go ahead and go on to the next question, if everyone's ready. And this is a question asking about access to food from March to now. And again, I'll set a timer for about a minute, 10 seconds for everyone to answer.
We're at 63.
Okay, and we'll do about like 15 more seconds. I think we had about 64 on the last question. Okay, we're going to go ahead and move on to the next question, question 3.
This one is focusing on your employment experience between March and now. Has COVID impacted your work in any way?
Okay, we have 64 responses, so we can go ahead and go on to the next question. Okay, and this one, oh, sorry, go ahead, Rose.
I was just gonna say, this one covers your brain health experience. So any anxiety, depression, isolation, or loneliness that you've experienced between March and now. And then additionally, what does your support system look like if you have experienced any brain health issues since March?
And we'll do about 30 more seconds for people to answer. Okay, about 10 more seconds. Okay, I think we can go ahead and move on to the next one. This was more about healthcare challenges regarding insurance and resources that you have access to. We have about 30 more seconds.
Once you're done, you can start adding up your total as well. How many points you had. We're going to ask you to input the number in the next question.
Okay, I think we've gotten the majority of the responses. I think it goes up to about 69. And now we're going to have you input, again, the total number of points.
As you can see here, the numbers are adjusting based on the number of responses we've had correlated to that number. So 70 and 65. 70 is the max amount of points. Thank y'all for taking the time to do this. And I'm sorry if we weren't clear enough at the beginning about adding them up. I'll wait a few more seconds for you all to add in. So as these last numbers are coming in, I want to use this to frame our conversation. You know, we didn't know what the numbers were going to look like. We didn't know who was going to be on the other side. So I think one thing this tells us is that it can go two ways. One, we can be working on projects that are with people that have a different experience than us. And so how can we do that in the best way possible? If we have access to a car, reliable transportation, our employment hasn't been affected, how can we go into this work with the empathy to be able to work for the communities that we serve? And so we look at this through a social determinants of health lens. So Adam, if you could switch back to the PowerPoint. And then go to the next slide. Great. So this is the social determinants of health, and we use this at the Design Institute to inform our work. So we are thinking about healthcare outside of the medical care complex and what that means and what that looks like. And in so many ways that comes down to access. And so we wanted to do this polling experience for you all to help you understand either where you are positioned and how that may be different from the people that we serve, or maybe you are similar to the people that we serve. And what does that mean? And how can you bring that to your work as well? So that was really just a starter into empathy for our work. I will pass it back off to Stacy, and he is going to now take us through the case studies.
Awesome. Thanks a bunch, Rose. You know, the nature of the work that we do at the Design Institute for Health spans a pretty broad spectrum. We'll do work in global health, we do things at a national level. But the reason we're at UT and the reason we're in the Austin community is because our focus actually here is locally and regionally. There's a lot of really unique circumstances in Austin that brought us here and then keep us here and keep us doing really interesting work in the community itself. And when we do that work, we often begin to see some overarching themes emerge. And I think this panel discussion is a chance to elevate some of those, to reflect on them and to think a little bit about what it means to try to improve the systems through which we deliver health and healthcare. As Rose noted, though, we also have to be really conscious of where power resides, because it doesn't always reside in the hands of the people who need the most help. And so we're going to share a few case studies of work that we're doing here locally. Some of them have been completed, others are still ongoing, others are just getting started or in the midst of it. I'm going to give you a sense of not only the work that we're doing, but also the learnings that we're finding. So over the course of the next about half hour or so, we're going to highlight 3 case studies. And in each of those, you're going to hear a couple threads, which we asked the panelists to sort of pull on. The first one and most important for us is the human stories at the center, at the core of the work that we do. We hold the humans at the center as our priority, right? You know, essentially the work that we do is in service to the social contract we have for the people they serve. And so we're going to start with some human stories. We'll share some context for the project as well, so you understand what we're doing. But we also recognize that the work we do is part of a much larger system. Very little in health and healthcare now isn't actually a system problem or a system challenge. And so we'll talk a little bit about systems. We're definitely going to touch on power and privilege because that has such a huge effect in the way that we serve those who need. And then we'll talk a little bit about what's happening beyond the project itself. So, so you'll recognize those elements, I think, in the case studies that we end up talking about. The first one is actually a project that sits in a housing development called Think East on the east side. And I'm going to let Ryan and Natalie talk about this in a second, but I just want to set a little bit of context, and that is, you know, as Rose was talking about, it's one thing to think about our health in the context of, you know, the quality of our medical care and the access to it. But also, we realize nowadays that most of your health actually is derived from the place that you live, you know, where you play, where you where you commune with others, where your family is, where you work, and sometimes where you eat. Well, definitely in this time where you, where you work. And so Think East is a perfect example of that. It's a relatively new housing development on the east side, but I'm not going to steal too much away from Ryan and Natalie, and I'll let them introduce it. So Ryan, I'll let you take it away.
Hi again. So I am a licensed social worker, and I was hired in April to come in as a service coordinator for Think East, basically to work with the design team and the way they had been reconsidering how to do social services in this context. So as part of that, I engage with residents kind of as much as I can. In June, I got a call from a resident talking about her experience with COVID. She was talking about many relatives who had been sick recently. And then she started also sharing with me residents at Think East who also had COVID-19 and who were currently quarantining. And she has 3 young grandchildren that she's caring for. And she's talking about watching management and residents walk around without masks all the time and how she was feeling about it. And the more I thought about it, the more I realized that the contact I had had with residents, those residents seemed fine. They had what they needed. And so I went to the design team and I was like, hey guys, I think there's a bigger issue here. I think we need to figure out a way to reach out to the apartment complex as a whole again and ask what people are needing so that we can reach out. So we went to management and we were able to communicate with every single resident. And the pictures on the screen are from that initiative. I received almost half of the residents were in need of masks and other disinfectants. And within about a week, we were able to have community partners donate those masks. And we were able to get together as a team and put together kind of, we called them COVID care packages for the residents and to get them to their doors. So we were able to kind of bypass, issues of disability and being able to get to us, all of us wearing masks, walking around the apartment complex, delivering them straight to their doors. Since then, that was just kind of the beginning of true cooperation with management there. We've been able to use this exercise, this initiative, as an opportunity to kind of springboard additional communication with residents. Over the last 5 months, more and more residents have come out and meet with needs or with concerns. I've been able to launch more and more initiatives. And we are just continuing to build trust and relationships with these new residents as time is going on.
Yeah, and I think
Natalie, you were
yeah. And going back to the context of this project, Adam, you can go ahead and go to the next slide. Whenever we approach a project, especially at the Design Institute, we really, as Stacy and Ryan have mentioned, we can't really just consider the core user. So for this, it would be the Think East residents. We really have to acknowledge that there are other systems and structures outside of just the main user, the resident, that impacts their health and social determinants of health. So for example, having access to public transportation impacts their ability to be able to go to the grocery store or even to be able to ride the bus at night because the bus stop isn't anywhere close to where the complex is. Same with education, like certain school zones have been limited for the parents there at Think East. So whenever we started bringing these social services to the complex, we've had to think, okay, what are these other structures that exist that may inhibit these other factors that end up affecting their health? And then, Ryan, I don't know if you want to speak to the power, privilege, and access, but I can intro it a little bit where we have recognized that design with it holds a lot of privilege. And that's something that we've acknowledged going into this project. And so the residents themselves, we have, they're not used to having the agency and the privilege in their life to be able to do the things that they've needed to do. So as designers, we've made sure to pass that privilege back onto them because they're the ones that are experts in their own lives. So that's really the approach that we've had with creating these services and iterating upon them.
Yeah, absolutely. Most of our residents at Think East that we've at least had contact with are women, individuals of color. Many of them are struggling with disabilities, and every single person at Think East is dealing with poverty to some extent. As a result of kind of these identifiers, these aspects of their identity, they have been subjected to, systemic racism, systemic sexism, systemic classism, and there has been at some point in their lives, and there has been some limited access to these resources for all of them. As a result of this, a lot of these residents have just kind of an inherent distrust in the system and in people from the outside coming in and offering help and support and saying, hey, we have all of these amazing services for you. One of the most powerful stories I heard was from a resident who was involved in the very beginning of the design process, just flat out asking the designers, like, are you guys coming back? Are you guys going to leave? And she has since spoken to that multiple times, and she's like, I think you guys have done a lot of good for the community, but that was the thing I needed to know before I could invest in you guys. At the beginning of 2020, that's when the design team came in and began developing services and going through the initial interviews and beginning that design process and building rapport with the residents. And that huge pivot in March to virtual services has definitely, it's been challenging in some ways because we have many residents who have limited access to stable Wi-Fi. Literally one of the buildings, you cannot get data on your phone. Like I cannot make a phone call on the second floor of one of the buildings of this apartment complex. But we also found other residents were reaching out all of a sudden, right? People who had been struggling with mental health were suddenly like, oh, I can just talk to a person and there's a distance, right? There's a computer screen between us. That was super helpful for them. One of the kind of the biggest lessons that I took away from the design team and from the long onboarding that I had with them was continuing to create that feedback loop with the residents, constantly going, what is it that you are needing? What isn't working? How can we help you? Right? I am not here to do it for you. I want to do this with you, right? This is a journey that you guys are going on. I'm not here at 10 o'clock at night. I don't know what the problem is. You have to share with me. And then we can figure out what the steps are to go beyond that. And our residents really they've embraced it. My newest thing is starting a community check-in once a month, and residents, like that has been the most popular service I've had over the last month or so. New residents coming in just to share, this is what's happening. This is what I'd like to see. Can you try doing this? And it's very exciting.
Then Adam, if you want to go ahead and go to the next slide. Relating back to our design process, it's somewhat similar to other design processes you may see of like understanding your users, creating, iterating, launching, maybe going back and iterating again. Next slide, Adam, please. But I wanted to acknowledge, what Ryan said about the residents saying, are you going to be leaving anytime soon? And so we knew that when this grant was over, we had to create a sustainable business model to make sure that these services could still be provided for the residents and they could change based off of and adapt based off of any new needs that the residents may have. COVID's a perfect example of that. We really had to pivot whenever we moved services online, and then also with these needs for masks and disinfectants and all of that. And especially even relating back to the element of like privilege and access, we all had an issue trying to find masks and disinfectants when COVID hit. It didn't matter, if you had money or not, like it was hard to access that. And so it was made even harder for these residents. So the fact that we could pivot and meet that need and create this sustainable relationship really made that possible, especially with what we've been seeing it as is sustainability and building relationships really creates this trust between us and the residents, especially Ryan and the residents, who's done an amazing job as she's spoken to. And that really made our response possible because these residents aren't, they're used to instability and things not being supportive, in their space. So because of those relationships that we've built, we've been able to, as you can see on the screen, like be able to create a service, launch it, get feedback, have residents be the co-designers in this process, iterate on the service, launch it again. So we've been able to really take that approach here. And then Adam, if you want to go ahead and go to the next slide. And so for this project, we actually had, it took quite a while to distill it down to what it really was, because we have elements of service design and social work and behavior change. And really what it came down to was design was important here because we reimagined how a social worker like Ryan could solve the needs for the residents, and especially in a sustainable way. Again, because there's no point in creating these services and then them getting up and leaving when the funding runs out. So it took a while, but we finally distilled it down to why design was important here. And it's really because of how we molded that with social work.
I mean, I certainly agree, but then again, I'm a social worker, so I'm going to agree with anything amazing about social work. You know, one of the coolest things I love about this project is that because the residents have such a loud voice here, and because it is so encouraged, the amount of empowerment that I see over and over and over again, kind of from these residents, from the feedback, right? They call me when they're like, I don't know what to do. And I'm like, well, what have you thought? And they already have these ideas, right? They're already like, I want to do this, this, and this. Do you think it's too much? And I'm like, I don't. Like, let's talk about that. How does that look? Who do you need to call? And kind of problem solving. I have a trauma background and a trauma lens in my whole career. And, you know, part of trauma is building relationships and trust and consistency. And so from jump, it has been very like, we need to, I'm going to show up. If I say I'm going to follow through, I follow through, or I'll apologize if I miss a service or if I miss a phone call, you know, especially right now with the inconsistency in life. But like what the resident at the very beginning who kind of alerted us to the needs of the residents regarding masks, right? She reached out last week and was just like, it had been a few months since I talked to you. I just wanted to reach out and let you know how I was doing and what's going on in my life. She didn't need anything. She just wanted to connect. And it was this kind of like, we were finishing up this project and this presentation, and it was very much like this beautiful bookend for me. Right, that even though she didn't have a specific need, she'd been thinking, right? She'd been thinking about us and about how engaged we were in the community, and she wanted to make sure that we knew that she was doing okay. And you know, last week our apartment manager left, and so the management, the complex as a whole, is getting ready to go through some inconsistency. And I'm not hearing a lot of concerns. I'm not hearing a lot of fear. I'm hearing a lot of, well, I know that you're going to help us, right? You are going to continue being that voice, and you know, there's a lot of spoken, at least I can't speak to how they're feeling at this moment, but there's a lot of spoken confidence about the relationship I was building with management and about the initiatives that have been moving forward. And so these residents living in this complex, where they are a mile and a half from the nearest grocery store, right? And a mile from the nearest bus station, and who couldn't get access to drive-through food pantries, right? All of a sudden they have a service in their door at like on their floor that they can reach out to about anything. Right. And I will help them find and help them make those connections and help them overcome those barriers. And they're utilizing it. They're seeing it. And I think it's built a lot of consistency and stability, even though there's instability with management.
Yeah, thanks for sharing those stories, both to Ryan and Natalie. I think what's really powerful here is that, you know, the human connection, the eagerness to engage and to engage sort of enduringly is an indication of trust, which is super hard to come by, right? You know, you don't walk into a project like this thinking, oh yeah, I'm going to design for trust, because that's such a difficult thing. You try to design for very tangible things, and you think about services and the provision of those services, but ultimately you're designing for trust, which is an absolutely huge human need. If you guys heard the opening to Austin Design Week, we talked about that as like one of the most basic human needs, and especially in a time like this. So thanks to you all for sharing that. We'll move on to the next study. Adam, if you go to the next slide. So switching streams a little bit, you know, in the midst of, you know, you heard a little bit about the impact COVID had on a project we were doing already. This project was specifically in response to COVID. So in early March, just as COVID was making itself known in Central Texas, we got a call from the dean of the medical school and from other community health provider leaders, and said, hey, look, you know, we need to set up drive-through testing. And they had never done it at the scale necessary to address a pandemic like this. And they said, look, we don't have a ton of experience doing this. We don't really know the operational aspects we have to consider. Could you help us figure out the best way to do this work? And so we headed into the project thinking about really mostly operational workflow issues, but I think we discovered a lot more along the way. So I'll hand this over to Rose and Arten to talk about, and they'll take you through some of the aspects of the work.
Hi, everyone. So I'm going to tell you a story about an individual that we came into contact with actually through the Think East project. And I think this helps frame the complexities of the drive-through project. And then, of course, the broader system that is operating within. So I actually got involved with a woman who had received one of our Think East flyers and saw the phone number and it said, call us. And she called in a crisis. She is an older woman. She's about 70 years old. She lives by herself in North Austin. She doesn't have a car. She doesn't have a support system here. And in late March, she started showing symptoms of COVID. Well, she called her home health provider, and her home health provider said, well, we cannot give you, we have to stop services until you have a COVID negative test. Her home health provider helped her cook, helped her bathe, helped her clean her home. And all of a sudden, those services were stopped. Now, she called us in a panic. She was running out of food. She was weak. She was depressed. She was having a really, really hard time. And I talked to her multiple times. And we just talked through, okay, what's going on? How can we, navigate this crazy system that is being exacerbated by COVID and figure out how we can get her home health reinstated? And it took weeks. Honestly, it took weeks. And she, was having a really hard time. We were figuring out how could we get her food and what needed to happen so that she could be okay until her home health was back in order. But I think this really highlights a barrier to access in a drive-through. When someone doesn't have a car, someone doesn't have reliable transportation, she didn't have anyone that could drive her to a testing location so that she could get that COVID negative test. So I think that really painted a picture for us about, the issues of, looking beyond just a drive-through, what other system issues are at play here. And as designers, how can we think about this more holistically, especially within our scope and in the project that we're working on at the time. So I'm going to pass it off to Arten.
Yeah, so that story was quite a difficult one. It kind of showed how access to testing was difficult, which at the time was difficult for everyone. As you all remember, this was early on in the whole COVID, where everyone was trying to figure out what to do and how to deal with the situation. So initially, as Stacy mentioned, our goal was to approach it, to redesign it, make it more efficient. But because we brought a human-centered design approach to it, in which we considered the different stakeholders, how they were involved throughout the entire journey of the system, we actually discovered that it was the biggest barrier to efficiency in all of this working wasn't necessarily any logistical or protocol issues. It was actually kind of the human needs behind it. The users wanted to have a sense of security. There was a lot of anxiety involved in the situation. So we looked to also addressing some of the human emotional needs along that journey as well too. And I think in this situation, it was a particularly difficult, once in a lifetime situation, because it affected all systems in all institutions in every country and basically everyone. So we weren't only just considering the systems within our local environment. So we weren't only just considering the local hospital systems, but when we're working on this project, we had to consider every single hospital system within the US and frankly, the world, because all healthcare systems were fighting for the same PPE resources at the time, same testing resources at the time. And we also had to, from the onset, kind of step back and think about what is the larger goal, the overall goal of all healthcare system in this current context. And aside from providing care to the sick and dealing with the pandemic, we realized another goal of the larger system was to not get overwhelmed and hit their capacity. And that's why in this case, the drive-through model was something that was really worth pursuing, because it diverted some of the traffic that would have been that would have overwhelmed the hospital, diverted them taking care of testing elsewhere, to allow the areas of critical care to not get overwhelmed. And so we had to consider those systems, which is a lot of systems to consider, but do it in a quick manner, because it was critical to improve our testing site, get it up and running, make sure it could scale, it could handle volume. But also another goal that we had in a way to help this quick ongoing situation was to then create an open source guide that would help other municipalities, other institutions around the country quickly set up their own drive-through testing sites. So we did the groundwork in laying out how it should be, suggestions, workflow efficiencies, the needs of everyone involved in the whole system and how to address them, and then put this out there so a lot of people wouldn't have to do the groundwork like we did, and kind of help with the national response.
Great. So I'm going to talk a little bit about power, privilege, and access and how that intersected with the work in the drive-through. You know, I think in some of the projects, that's at the center of the project from the beginning. Like Think East, we were very aware of the power and privilege that we had as designers from UT, and then also how access was going to impact the residents' ability to receive services. With drive-through, that wasn't something at the forefront, right? It was uncovered in the research. And I think we're all striving to do a better job of making sure that we're coming in with that lens through the work that we do. You know, I think to Arten's point, this was a pandemic that impacted everyone. And so one thing that we uncovered in the research was that there were limitations to power and privilege. The traditional sense of money being able to help you really had its limitations in this sense. And especially at UTHA, you had to be either a current patient or a UT faculty and staff. So you couldn't pay to get a test there. You had to have these personal connections in order for you to get the test there. And so this posed a new challenge. And how do we think about, creating equitable structures and systems at a time where, everything's being strained. And so I think that was something that we really uncovered. And then again, as Arten mentioned, when you have something that fundamentally relies on reliable transportation or some form of transportation, how can you think broader than that? And what is this broader system showing us? So Adam, if you can move to the next slide, I'm going to touch a little bit on our design process here. And this one's really different from Think East, because as you can see after the launch, there's arrows. This was meant to be broadcasted. The guide was meant to be sent out to the world. And that was the end of it, right? It was meant to be short-lived. It was meant to have a short time span, because as everything was changing, I mean, look at where we are now compared to when this was created in the beginning of April, end of March. Guidance has changed so much. Right? So how can we think about making something really quickly, turn it around fast and get it out there so we can pass the ownership off, so that individuals, like Arten said, the municipalities and the other entities can then actually iterate on the guide themselves. So this is something we're really thinking about, how is this is very different from Think East, where we were very intentional about creating something sustainable. And so we just wanted to leave you with, I think it's really important to think about in a crisis response, what happens? Everyone kind of jumps into action and there's not necessarily a coordinated response. So how can we as designers help make that coordination happen and be more intentional so that we're setting things up that do have feedback loops and we can iterate in the way that makes most sense? And so Arten's going to finish it off with why design here. But I just want to leave you with, what do we do with this? What is this teaching us, and how can we think about, in any future crisis response, the role that designers can play?
So thank you, Rose. I will keep it short. So why design in this situation? I think if we were to approach this from simply a systems engineering perspective, just to make things work better, faster, we would have overlooked the human needs, everyone involved in making this happen, and what they're going through emotionally, which affects the work. So we realized that the fear and anxiety in this unprecedented time was actually the greatest impediment to operational efficiency. So.
Thanks to both you, Rose and Art. And I'll just reflect on one thing. There could not be a greater system problem than what we're facing now in the pandemic, right? It is the system of all systems, right? And I think the most interesting thing is that even in trying to address these massive system issues, right, trying to divert traffic away from the critical healthcare infrastructure, trying to ensure that a population as a whole gets tested, and it's still the human issues that actually are the drivers not only of efficiency and our ability to accomplish what we're trying to do, but actually at the core of how, what's driving a lot of the transmission of this pandemic as well. Cool. So we're going to move on to the last case study. And this is actually around nursing homes. So, nursing homes are in the news all the time, early in the pandemic, and still now, the large majority of deaths and illness were happening in nursing homes. And a resolution was passed by Austin City Council in May, instructing the city manager and the Austin Public Health Department to work with the Design Institute to actually look at some of the larger systemic issues, making it more difficult for them to combat the transmission of the COVID coronavirus. And so, a lot of immediate response had already been stood up, trying to get PPE and things like that. But we also recognized there were some deeply embedded sort of legacy issues that were keeping the nursing home systems and industries from actually responding effectively. And so that was essentially the remit that we were given in looking at the challenges facing these facilities. So I'm going to hand this off to Rose and Natalie again, who are going to talk a little bit more about the human elements and the broader story around this project.
All right, thank you, Stacey. So as Stacey mentioned, nursing homes tend to be poorly portrayed in the media. And so I think one of the biggest takeaways that we had is really this is a story of people and heroes. And these are heroes that are working in a system that's in a lot of ways working against them. And so in the first few phases of research, we really uncovered just some amazing stories of staff sacrifice that they have endured throughout the pandemic so far. We had one father who he created a donning and doffing space in his garage so that when he came home from work, he kept all of his work clothes separate from his home where he's a single father. He also screened his son's caregiver every single day to make sure that he was keeping his son safe as well. We had another woman who she had always spent all of her time in her community, and she was, very often caught hanging out with her neighbors in the neighborhood that she lived in. Yet she wasn't doing that anymore, and people were worried what had happened to her. But she was just trying to do everything that she possibly could to stay safe. And then, I really want to highlight one story of a director of nursing at a local long-term care facility here. She's a single mother, and back in April, she decided that she needed to self-quarantine away from her 2-year-old son. So she asked her parents, hey, can you take care of him for a few months, and in hopes that the pandemic will be resolved and we can live back together again. However, here we are 9 months later, and she ended up quarantining from him for 3 months. And I think, this was a pretty rigid approach, and she looked back on it as, there was a lot of emotional burden that came with that sacrifice. But, does she regret leaving her kid? I mean, who wouldn't, right? But I think what this shares more is how much she cared for the people she served in the facility that she worked in, and what she was willing to do to make sure that everyone stayed safe, her family, herself, the residents, and the other staff members at the facility. So Natalie, go ahead and take it from there.
Yeah, so again, we're gonna take the systems perspective on this. And as Stacey initially said, we were commissioned to look at how we could prevent COVID-19 from spreading more in nursing homes, trying to figure out why the spread was so great, and even think in the future for sustainability perspective, God forbid there's more pandemics in the future, like how could we prevent that from happening too? And as we went into the research, we recognized that COVID did not exist in a vacuum. Staff interact with residents, staff leave and go home, they go to the grocery store. There's a lot of those structures in place, including like residents going to the hospital and coming back. So we couldn't just look at it from the lens of residents and the staff, or just looking at the nursing facilities themselves. We had to consider all the other structures that encompass the long-term care system. And there's even, it even goes up to the macro level of like how as Americans, we view long-term care, and we view, aging and giving up our individualism and freedoms when we eventually go into nursing homes or get older. So there's that. And then even as Rose touched on, like media portrayal affects our views on long-term care. So we went in with looking at research for COVID transmission and uncovered all of these other things. And I think the one thing that design especially does differently here is the fact that, nursing homes are focused on like resident care, meeting financial needs and all of these other things, but staff are often left as the last thing to sort of care about because there are all these other urgent needs ahead of that. So we are really taking this user-centered lens to this, and we recognize that staff well-being greatly impacts resident care. So we went in for COVID transmission, we found all of these other things, and right now we're really focusing on staff. And right now in our design process, we have done research over the last 6 months or so and are going in and creating concepts with the facilities themselves to iterate and co-design with them to see what solutions could end up working. And before we wrap up, Rose, I don't know if you wanted to go into the power, privilege, and access element too.
Yes, I'll just quickly touch on this. Again, similar to the drive-through, it was not something that we were thinking about going into it, but as Natalie said, so many things came to the surface throughout our research. And I think, the biggest thing for us as designers, and what I challenge you all to think about is, are we designing for equity, or are we perpetuating systems of inequity, right? And what can we do as designers to break those existing power structures and systems that are in place and that have been perpetuated for years? And what can we do to challenge those really make some big systemic change? I think, just a few things I wanted to share about the inequities that we uncovered in nursing home. There's only 10% of the nursing homes in Austin are east of I-35. What does that say about access and resourcing? We heard stories of, operators and administrators putting their own money out to pay for PPE so that their staff could be protected, but then having to figure out how to reuse it because they weren't getting the resources they needed from other places. And so, I think there were just so many things that uncovered. You think about staff, many of the facilities had 4 salaried employees. That means everyone else was an hourly worker. What does that mean for benefits? What does that mean for time off? And when you're in the middle of a pandemic, when there's, high anxiety, high fear, and you're working in a healthcare space, how can we make sure that staff have more of that safety net that doesn't exist for hourly workers right now? And especially when our insurance is so often tied to employment, how can we think differently about that moving forward? So I think design plays a really interesting role here. And Natalie, go ahead and finish it off.
Yeah, I think lastly, I was just going to say that the long-term care system, like a lot of other legacy systems and infrastructures, is not incentivized to innovate. So that's really how design plays a part in this, is we're coming in as generalists, not as experts in this area, and really trying to think long-term in the broader sense, how could this space be different while also meeting the regulatory and financial limitations of this industry. So we've had to really balance that. So that's I think where design plays a unique part in the long-term care system.
Awesome. Thank you, Natalie and Rose, for that. And so we've managed to stay mostly on time. We're leaving a few minutes here. We have officially 6 minutes on the clock to answer a bevy of really great questions. And so it's not entirely clear if we can keep this broadcast going past 9:30. If we can, the rest of all the panelists will stay on. We'll continue to answer questions. If we can't, I think we suggest that we'll bring this onto Twitter. We'll do an ADW hashtag and a Designs in Health one as well, and we'll try to cover off some of the questions. But we'll see what we can tackle in the time that we have here. I'm looking at the Q&A. Clearly, the most upvoted one is a question posed by Jen B. So thanks for that. And you asked, when we do design projects like these, do we design with an intent to follow up in the years after, long-term, 3, 5, 10-year timeframes? And the answer is absolutely yes. It's actually one of the most unique circumstances that surrounds the Design Institute for Health and why we're here at UT. You know, many of us came from, well, we come from a lot of different backgrounds. Many of us came from commercial consulting, design consulting and the like. And one of the challenges, you know, and I think as designers, you guys all recognize is that, you know, we have a hand in like imagining what the new and shiny thing is, and then we leave it to somebody else, sometimes often clients, to actually execute on. And then we don't have a hand in the long tail of execution. And what was really different about coming here to this community, being part of the medical school, being part of the university, being supported by tax dollars from the community, was that part of the commitment was to see these things stood up and to endure. And that's a really unique circumstance for, I think, designers, one that's really validating and also one that's super challenging, right? You know, it's easy to come up with really fresh and shiny ideas. It's another thing to execute on them and to really come to terms with the barriers to implementation, to launch and implementation, and then to sustainability. So thanks for that question. It is one of the things that we think most about. This next question, I'm going to hand over to you, Rose, but let me see if I can interpret it a little bit. Brandy, you asked this question, outside of the social worker brought on the team, did we seek any other social service subject matter expertise for Think East? And I'll let Rose comment on that. You know, we have just on this panel 2 formally educated social workers who bring a ton of experience to the field. We also built on a platform around services that sort of informed the starting point, but I'll let Rose answer that question in total.
Yeah, of course. Brandy, thank you for that question. So I think one thing that's really interesting about the Think East project is that it was a partnership between the School of Social Work at UT and the Design Institute for Health. So I actually got involved in this project while I was still a research assistant. I was still a graduate student at the Steve Hicks School of Social Work. So from the start, this Think East project had a social work thread that we've since recognized that we needed to have that moving forward as well, which is why Ryan coming on was so important. But we also did a lot of community resourcing and trying to understand what was in the neighborhood to figure out what residents had access to. We talked to United Way, we talked to Foundation Communities, we talked to so many other social service, like you said, SMEs, to make sure that what we were doing made sense and was appropriate. And I think too, you know, one thing that we really learned is that it was really the individual needs that bubbled to the surface more than the community needs. We were providing community services prior to COVID, but since COVID has shifted, Ryan is really addressing more of those individual needs. And so a lot of the existing social service providers in the community are actually doing a very different approach than the way that we've taken it. But we met with everyone you could possibly think about to ensure that that was informing the design that we were trying to create.
Awesome. Thanks, Rose. We only have a couple of minutes left. I think we'll pick off the last question here before we close. And this question is from Michelle Osman. Hey, Michelle, thanks for the question. And it is really around the notion of self-efficacy. And, you know, we say this all the time. We quote Rose all the time, which is, you know, people reserve the right to self-determination. And that's a really important tenet in the work that we do. And so you asked about what are the sort of steps and ways we ensure that we nurture and honestly perpetuate self-efficacy. And it's a great question. You heard a little bit of it here in the sense that we do co-design, right? We're never designing for someone or on behalf of someone, because by doing so we inherently channel our own bias. But even more importantly is we don't ask, one of the most important things that we do in the stages of our work is actually to pause after our initial design research and actually to reframe. Because, you walk in, with either a formal or informal hypothesis about the things that you think you're trying to solve. And design research is about discovering actually the truth, sometimes in spite of those hypotheses. And we make a really intentional point of pausing and reframing the problem that we thought we originally were solving for, right? And the most important aspect and the most important input in that reframing is the human needs evidenced by the people who we are serving. And so setting that frame, setting that construct is critically important so that we're actually solving for the right problem, and almost always self-efficacy becomes one of the primary considerations in that design effort. Awesome. So we're at 9:30. I don't know if we're going to get abruptly cut off or not, but I want to thank you all for joining us. Again, it's really gratifying to see so many people interested, designers especially, interested in health and healthcare. It is obviously our passion. You know, we often joke there's only a small herd of unicorns of designers who are interested in this work, and I think what we discover over the years is that there are more and more. So thanks again for joining us. It's always a pleasure to be part of Austin Design Week. We hope you enjoy the rest of the time and all the rest of the presentations. We'll hang out here for a little bit longer in case we have an opportunity to hang out and answer more questions. Thanks a bunch.
And take the survey if you can.
Oh yeah, there's a survey. Where is the survey?
It's in the chat.
It's in the chat. Look for the chat. So many windows open.
I will copy and paste it again.
Awesome. Thanks a bunch, folks. And we'll dwell for a little while. Looks like we haven't been transmission hasn't been cut off. We're officially past 9:30. So we'll see if we can answer some of these other questions.
You've got about 5 minutes. We do have another event coming up on this exact channel, so we definitely can't go longer than 5 minutes, but let's definitely get through as many questions as we can. And then I encourage everybody to join the community Slack. We will start a thread for this event as we have for all of the others, and you can just put more questions in the chat, and the panelists hopefully can join us there and answer some of those.
Awesome. Thanks, Candace.
Yeah.
So we'll take advantage of the roughly 4 minutes we've got left. Rose, you had something?
Yeah, I was just going to see if Ryan wanted to add anything to the self-efficacy question, because I think she brings a really interesting perspective with the licensed social work background. I mean, I know this is something she's really intentionally working on a daily basis.
Oh, goodness gracious. I think you guys have largely covered it. I know that it's constantly being reinforced. Like I'm always trying to reinforce that and reinforce kind of all the things around it. I have some residents who want me, like they get mad that they get links and phone numbers. So like, why aren't you doing it for me? And I just remind them like that's not my role. Like if you need me to like go over it with you or talk about questions, right? So I spend a lot of time specifically working on like, how can I help empower? And then within the complex as well, right? If I'm getting concerns or complaints, like Rose and I have spent a lot of time talking about how can we empower the residents to take that into their own hands so that I'm not going to management constantly with the complaints.
Awesome. Thanks, Ryan. Hey, we'll see if we can pick off at least one, maybe two other questions here. There's a question here from Dandia Giri about interest in service design. You know, service design, I wouldn't call it nascent anymore. It's been around for a while, but it's certainly not as well established as some of the legacy design practices like graphic design or like there are a number of schools that offer, general service design degrees. I think Savannah College of Art and Design. I know a couple others do as well. Here at UT, we actually launched our own master's degree in design in health, and we cover service design explicitly in the health and healthcare context in the course of that one-year degree. But there are also, a field of practitioners. There are, Adam might even have some thoughts on this. There's a field of practitioners that are focused in service design. There's a number of international and national conferences that happen every year that focus on the development of that discipline in particular. And I'd encourage you to check those out as well. And then I think maybe we'll pick up this last question, which is from Deepti Nalapaneni. I hope I got the name right. Were there any barriers to providing services with management? And I'll ask Rose to answer that question too, but I will make one comment first, which is, something that you're bringing up here is really interesting, is that there's multiple stakeholders in any of these projects, right? It wasn't just about the residents and what they needed. It was about what the management at the properties were in some cases required to do. So anyway, I'll let Rose answer that question.
Yeah, no, I mean, this is something we could talk 4 hours about. I think we had a lot of barriers at the beginning, and we had to try to convince them that what we were trying to do was a good thing for them. And I think inherently they figured out it was, because for tax incentive purposes, they had to provide services. So we were meeting a need for not necessarily from their perspective for the residents, but for their taxes. But this is a constant challenge. And I actually want Ryan to speak to some of the current challenges that she's had. And then more importantly, what she's tried to do to keep showing I'm here, I am building relationships with the residents, and I am trying to build a relationship with you as management in order to make this work, because Ryan's hands are a little bit tied if management doesn't have her back. So Ryan, if you want to add anything there.
Yeah, and Ryan, we'll just have to keep it brief because we have about 30 seconds, I think, before we have to go.
Exactly. So as a social worker, I see management as an additional client here. So I treat them very similar to how I treat the residents. I'm very upfront about my needs, very upfront about how I'm trying to help them. I try to be super transparent, and I'm constantly trying to get buy-in. I have a lot of experience working with clients who don't want to work with me. And so I use those skills to engage management.
Awesome. Thanks, Ryan. And for Lena and Sarah, and for the questions that you've posed, maybe we'll cover them off on Twitter. Feel free to tweet at us. And thank you all for the fantastic engagement and the conversation on chat. We always love being part of Austin Design Week. Thanks again for joining us.
Thank you.
Bye now.